This is our Stat 705 final project. I am Josh Gertzen.
I'm Justin Monty. We hope you enjoy our project. Our objectives for this study were to examine if sexual orientation would have differences in the scores of mental health metrics and how they correlate with BMI, physical activity, and gender identity variables. It is known that physical activity can improve mental health scores in general populations. However, it is not known if this is the same case for non-heterosexual individuals.
For our methods, we used Prolific. It's an online survey tool. For this survey, we got 530 people, and we cut that size down to 486 for complete surveys. In the survey, we included stuff like demographics, like race and ethnicity, sexual preference, non-straight and straight, the Godwin Weekly Leisure Activity Score, which measures physical activity, height and weight measurements, which were for BMI, and receptiveness of discussing physical activity with a therapist, and then mental health matrix, which we will talk about in the next slide. For this, we used SPSS programming to analyze the data and create linear models, which we will also talk about in the results.
The mental health metrics that we used were known to be valid and reliable. We used the patient health questionnaire, the generalized anxiety disorder scale, perceived stress scale, the UCLA loneliness scale, and the body dissatisfaction questions. These 3 body dissatisfaction questions were molded from longer surveys that were 12 or so questions, and so we had to get that shortened and able to use the survey tool that we used.
For our results, our linear models were gender identity, BMI, and reported physical activity minutes in correlation with mental health. For the physical activity and mental health linear model, physical activity correlated with mental health increases in heterosexuals. Mental health in non-heterosexuals was uncorrelated except for a positive correlation in stress. Discussing physical activity with a therapist among BMI, heterosexuals had a negative correlation with BMI and loneliness. Non-heterosexuals showed positive correlations for physical activity and male cisgender.
Here are some of the graphs that we had produced for BMI versus body dissatisfaction and gender identities, because both groups of heterosexual and non-heterosexual people had correlations with their BMI. We thought we would also analyze if gender identity had a role to play and how much each gender identity would be affected. If you look closely, you're able to tell that the slope for each of the lines and the heterosexual group seems to be a little bit steeper with higher beta values than the non-heterosexual group. You'll be able to see this in some of our future tables, but this was just a way that we could show the information and break it up even deeper by males, females, and then potentially if there's a gender queer, binary, fluid, or trans. The reason the graph on the left has a straight up line is because I think we only had a few people identify as heterosexual, gender queer, binary, fluid, or trans, and those people all happen to have a really similar BMI, but they scored differently on the body dissatisfaction score. So this is our demographics table. We tried to sample to get a good separation of each category, a good disbursement, if you will, of age, gender identity, sexual orientation, ethnicity, and education level. We were able to get at least a good representation of ethnicity. It was a little trickier to find people on the survey tool that had a gender identity that was a non-cisgender, and so those qualifiers were taken off the secondary search that we did, and so basically we ended up with these numbers of people, even though we did an initial search for a particular bunch of different types of people to have a good diversity of the survey. In this table, you'll see our initial linear analysis, beta values all combined with each heading of the mental health metric, along with each subgroup separated for heterosexual and non-heterosexual. We had to combine all of the different sexual preferences of non-heterosexual just so we could easily display the information. And so if you notice, the bolded numbers are the ones that were considered to be significant, at least a weak significance. If you look at the anxiety, you see that BMI and physical activity both had a negative correlation with anxiety scores, meaning that their anxiety was lower if they had a lower BMI and a lower physical activity. I meant to say that BMI, as it gets higher, you have a lower anxiety score. So people with lower BMIs typically have, people with lower BMIs don't have more anxiety, but people that scored higher on this metric happen to also have that. As far as depression, physical activity was able to impact depression scores, reducing the depression scores as far as this correlation was concerned with the people. Same with a negative correlation in physical activity for heterosexuals, for stress, loneliness, and body dissatisfaction. If you're able to see here, each of these had a correlation, whereas for the non-heterosexual group, physical activity did not seem to impact the mental health metrics except for in stress. Physical activity was able to reduce stress scores as the physical activity scores increased. Lastly, we have our receptiveness graph, or table, We are able to see that BMI had a weak significant correlation with how receptive people were for heterosexuals. However, non-heterosexual people did not have a correlation for BMI, and so BMI did not have a known correlative impact on how receptive somebody might be to see a therapist if they are non-heterosexual. However, their physical activity and identifying as a male made them more likely to be receptive to to discussing physical activity.
In conclusion, these results give excellent insight on how mental health therapists may prescribe physical activities as they treat diverse patients. These results also give insight as to some correlations that could cause increased or decreased severity of mental health metrics. Additionally, research should be conducted on what may be the cause of these correlations. Here at the bottom, you can see this graphic that we made just to really send this message home. It's that non-straight individuals with exercise does not equal the improvement of mental health metrics,
especially when compared to their heterosexual counterparts. Thank you. I hope you enjoyed our presentation. Have a great week.